that's just, chronic care management. And Dr. Green, happy Friday.
Good morning.
Well, and, as we dive into this, and get into, just this topic alone, when we talk about chronic care management, what does that actually mean?
So now we're focusing a little bit less on prevention and more on the management of people who have chronic disease conditions.
Okay.
And I think in the last 10 to 15 years, the medical community has kind of transitioned based on a lot of large studies to protocols or guidelines. And so GDMT, guideline-directed medical therapy, becomes important in terms of making sure that our patients are on the right treatments, that our patients are being monitored to make sure that those treatments are being effective and safe. And so what we've gotten into is not only following these protocols and trying to get insurance to work with us and cover these things long term, but we've also are starting to delve into more of the tech at home where we can monitor our patients remotely. And the reviews on home monitoring, including like blood pressure, diabetes, sleep apnea, congestive heart failure, chronic obstructive lung disease, and it's even simple frailty, the results are impressive in terms of better health outcomes, reduced trips to the emergency room, reduced hospital days totally in terms of admissions as well as duration of stay. So that's kind of what we're talking about. It's a big package, but we're focused now more on, our previous shows, we've talked a little bit about prevention, but now we're kind of past prevention, more of pretty much focusing on the management of seniors or middle-aged people, many of whom have multiple problems at the same time.
Well, and see, that's why I'm glad you touched on, some of the conditions that you could be, treating or managing with, those patients. And can we go into a few more of those, if that's okay, just to break this down for maybe the younger audience of what some of those chronic conditions could look like?
Well, sure. Well, we can start out with high blood pressure. The current guidelines are suggesting that we should have the patients learn how to check their own blood pressure and even to make the initial diagnosis, because there are more than a handful of people who are hypertensive in the office and they're fine at home. We don't want to overtreat them. And then at the same time, the guidelines for the management of blood pressure now is to have a systolic blood pressure at or below 130. That's very aggressive compared to our traditional, but those people, when you get there, have fewer heart attacks, fewer strokes, probably live longer, lower risk of death. I mean, the outcomes are solid. So home blood pressure monitoring would be one. Diabetes, we've got the continuous glucose monitors. Congestive heart failure, we have the in-home monitors that look at heart rate, blood pressure, and the patient's own body weight. For chronic lung disease, we've got in-home spirometers and oximetry to keep an eye on. For atrial fibrillation, of course, we've got rate and rhythm control there. And many of these, through partly microminiaturization and all that, we can have, wearables or other devices that the patient can be taught to use in the home. And many of these are directly or through an intermediary indirectly hooked up to the doctor's office, so we can see patients from home. And we've already been working with this now for about the last 6 months. I think we've got close to 100 patients who have home monitoring systems.
Wow.
And I'm certain that on several occasions we prevented an emergency room visitor or a hospitalization because we can see a change in the data. We call them up. Yeah, how are you feeling? Let's go over your meds. Let's change this dose. Let's change that dose. Let's come into the office, whatever it might be. So it's pretty exciting to see what's been shown in studies, for me to see it in my real professional life as an outcome.
Well, and, as we go into this conversation a little bit more, you were touching on, individuals that are getting, into the middle parts of their life and seniors that are older too. we're going to talk a little bit about that, 50-year mark and after 50. And to me, I can only imagine, that might be a little bit too late. How important is it to really get a jump on these things, as quickly as you can? To me, it seems like preventative maintenance and then long-term management goes a long way.
Well, it's interesting that you're asking me that question because I thought about that this morning about what is appropriate here for younger people. And just to drop back, I think for people who are say you're healthy and you're under 50, right? Make sure your blood pressure is under good control. Don't smoke. And make sure you're getting a good night's sleep. And if there's any question about that, check yourself for sleep apnea. Because sleep apnea translates into hypertension, cardiac arrhythmias, and a lot of other stress signals that go into the body that, and I think the statistics are something like 16 to 17% of the population has sleep apnea. So look at it this way. You walk down the sidewalk, you pass 6 people, one of them has sleep apnea. That's a lot of people.
Wow.
Yeah. And so for younger people, the wearables, like the Apple Watch or the iWatch or other brands, or this Aura ring that has come out that people are now wearing that kind of monitors their heart rate and their sleep. A lot of people come into me and say, hey, these things are giving me a message. I need to get a sleep study.
Right.
I got to find out if I got sleep apnea. And oftentimes high blood pressure will improve when you treat that. So that's on the younger side, if that's what you're asking me.
Oh, yeah, 100%.
And then again, I want to say it again, don't smoke. That's the time to do it. Don't stop when you're 55, stop when you're 25.
And, this is where I find this so fascinating is just, so many times I feel like we talk about somebody that we might know that, John Smith was in great health, last year when I just saw him at, the golf tournament. And then, within a year, it just seems like everything's changed. And I'm not saying maybe more frequent as of late, or as of recent, but it seems like, as I was a kid, that was kind of just the notion. It just seems like there was a lot of gaps in there. And what are your thoughts on that? Is the annual visit just not enough for somebody that is maybe stuck in the habit of, I do have these going on, but I'm feeling good just going, whenever I'm called in to go see the doctor?
Well, if you appear to be healthy, I still think an annual visit's appropriate because high blood pressure is asymptomatic. Diabetes in its initial stages is asymptomatic. If you have a lipid disorder with high cholesterol, you're not going to feel that either. So a lot of people have all these things running together. They feel great. They're playing on the men's softball team, over in the city or whatever. Everything is good. Nothing's wrong with me. And then they get hit with an event out of nowhere. And it's, my gosh, this has probably been going on in the background for 10 or 15 years. You got to come in and get it checked. Sometimes I jokingly like to say it's kind of like when you buy your car, you got the checkup routine there, your oil and all that, and rotate your tires. I think we need to kind of treat our bodies that way too, bring it in. A lot of these parts, you can't just, put a new tire on. I mean, you got what you got. You got to maintain it in good shape.
Well, and how important is it too when we go into, having, equipment at home like home health monitoring systems, and maybe it's just a blood pressure device that we talked about, earlier, so, any type of device. How important is it to have, just the right machine? Because to me, I wouldn't really know where to start. Is there a bad brand? Is there a go-to,
Okay, so I'm not being sponsored by anybody here, but I will tell you that Consumer Reports looked at home blood pressure monitors about a year ago. And I think of the top 7 brands, 7 devices, 6 of them were made by Omron, Omron.
Okay.
I think they've really cornered the market on home blood pressure monitors. That's what I have at home for myself. They're easy to use. The expensive ones have more gimmicks and gadgets like memories, and you can have 3 people logged into it and all that. But the very basic one, I think the tech is the same in terms of blood pressure. And this might be good for a whole, one of these meetings to go over the proper techniques. But nonetheless, in terms of what we're doing, blood pressure is a big one. And that's huge because sometimes what we get in the office is nowhere what the patient's getting at home in either direction. I hope I'm answering your
Well,
question.
that's what it was, because that's what kind of has always intrigued me. If, someone does have a device, a machine at home, and they're checking their blood pressure and it's just not working correctly, and how to, make sure that that's even, the right brand, or just making sure we have.
We ask them to bring them in, and
Okay.
we line them up, and we have them check it, and then we check it and make sure we're within about 5 points of each other. And actually, we had somebody in the other day whose blood pressure machine at home was not working right, and they were really worried about it. And turns out their blood pressure was fine, but this thing was reading 30, 40 points high. He said, I'm not a tech. We don't fix them. We say, throw it away, buy a new one. They're under $100.
Right.
And they came back with a new one. It was working fine. And that was a good lesson. And for us to bring the tech in with your visit, let's check it at the same time.
Well, and as you go into, the management side of things a little bit more, it seems like to me there has to be at this point in the process, because, we talked about the preventative side of things. Now we're here in management. It has to be, to me, to make this work, a lifestyle change in some of these cases too, where you can have the, equipment and you can monitor all you want, but if we aren't, doing what we need to do to stay active, or, try to improve some of our, habits, that could lead to, the same issues.
Well, that's a great point that you make, because what we find when we do in-home monitoring and the patient sees the data, it's powerful to motivate a change in their behavior. They're more likely to take their medicine. They're more likely to maybe watch their meal plan. They're more likely to get out and exercise, because now they can see every single day. So let me give you a quick example. With these new installable glucose monitors that go on the body somewhere and last about 2 weeks, they talk to your cell phone and give you immediate blood sugar readings.
Wow.
They've demonstrated that if you give a patient with diabetes a glucose monitor for 2 weeks, they themselves make enough changes in their lifestyle based on what they see. Not what I tell them, but what they see.
Right.
It's the equivalent of adding a full prescription of medication.
Wow.
So, and I think the same thing at home. When they see their blood pressures elevated, maybe they're not going to put as much salt on those French fries.
Right.
There are behavioral changes associated with the ability to see what you're doing. So some of this data is available to the patient. Now, there are some things that are complex, like we get heart rhythm reports on the patients, say, with atrial fib. There are some things with our chronic lung patients and their peak flow meters. Sometimes a download on a sleep apnea device, but all these things allow us to be in the home in one form or another, more minute-to-minute care. And I'm not making this up. I did a little look, but for COPD, diabetes, heart failure, hypertension, there's about a 25 to 35% reduction in hospitalization when patients who need these forms of care, we put the tech in the home and monitor them. So it's definitely effective. So Medicare and insurance pays for this when you have an appropriate diagnosis. They pay for the tech, they pay for our professional services and monitoring. So it is covered by insurance.
That was my next question, if it was covered and how that process would look.
Yeah.
Interesting.
I don't think they're going to cover some of the direct-to-consumer things like an Aura Ring or
Right.
an iWatch. But I don't know if maybe I'm not an expert, if your health savings account might pay for that. I don't know. But maybe if your doctor wrote a note that you should wear it, I think that's what it takes for OTC meds. So health savings account might cover that.
And that's a good point too. And, going into just if you've had any conversations or, had any feedback from maybe your patients or individuals that say, how is it overwhelming to keep track? And I know that, there's cloud data now that goes right back to you. Is there ever a time where someone might have to take, just the old pen and paper and, take notes on, what our heart, blood pressure looks like that afternoon if we have a modern or just a basic machine?
Well, most of these people with their blood pressure, they're writing it down and they're bringing it into the visit, but then again, they can call us if something's way off, which is helpful. And lots of times we can make adjustments over the phone then. And then they're one step ahead to the next office visit,
I'm curious about your perspective on this too. From as a physician, whenever you start to see this implemented, what does that mean for, the work that you do with your patients in the office? It seems like to me you'd be able to do just a lot more, and really extend the longevity of someone's, not just, life in terms of how long we live, but how long we can, live to enjoy it too. And I'm just curious from your perspective, when you started, if that is a shift you've seen and when you've seen that shift in terms of, chronic care management.
Well, I think following guideline-directed medical care and with an appropriate monitoring system, that's what your chronic disease management is, and particularly for these patients who have multiple problems, diabetes, hypertension, hyperlipidemia, sleep apnea, et cetera. I'm convinced, compared to when I went into practice 40 years ago, that these people are living longer, but they're also healthy enough that they're maintaining their physical and mental independence. They're staying in their home. They're driving their car safely. They are managing their lives and having their own forms of, recreation and socialization that otherwise, the wear and tear, say 40 years ago, that, was beating people up pretty much when they got in their mid-60s. You started seeing problems.
Yeah.
I got a fairly active group who are in their 80s and 90s now. Then I think I've used the term, they're my super seniors.
Yeah.
But I'm convinced it's a consequence of the application of guideline-directed medical care and appropriate monitoring of the targets to make sure we're getting where we're supposed to go.
I'm curious too, because you spoke earlier about, how a lot of these are asymptomatic, and we might not notice anything. We talked a lot about blood pressure. When it comes to blood sugar, is that something that we should be monitoring or just get a baseline for, or try to, before something happens as well?
So that brings us back to the annual exam.
Yep.
We routinely would check a blood sugar at that visit. And I would say that right now, in terms of the last, say, 10 or 15 years, I'm more likely to diagnose diabetes. I'm going to say 4 out of 5, based on somebody coming in who has no symptoms and has abnormal labs.
Wow.
We've got a few who will come in and say, I don't feel good. My vision's blurred. I'm drinking all the time and I'm going to the bathroom all the time. A classic diabetic presentation, maybe 20%, but now we're on it before the patient even knows they have it. If they're coming in and letting us open the hood and check the oil level,
Well, and I think that goes hand in hand with really, how efficient your office has to run for all of this to operate effectively too. And, because, getting all of that data as well as, seeing the patients for annuals and, every other service you guys provide. We just talked about HRT as well. You really have to have an effective office to get everybody on the right page and really to keep, everything just firing off like this.
So within our own office, even there, over the years, I've kind of designed protocols for the annual well exam, somewhat age-based. And we meet with our excellent nurse practitioners and with Dr. Scott Morrison and the rest of the team at 12:45 every Monday. We have a huddle and we review, what's the latest up to date, how are we doing, are there any problems? But in the background, we are trying to do things in a relatively similar way, so that, and we have, like I said, we kind of built protocols and benchmarks for ourselves that try to mirror the nationally published guidelines from all the specialty societies for the discovery and management and treatment of a variety of different conditions.
Well, and it's just fantastic to get those insights too, and really, tie this back in together. Before we start to wrap this up, I wanted to ask you, what's your message to somebody right now who is managing a, chronic condition and or about managing a chronic condition who might just feel fine right now, or maybe they know that they have it and it's like, hey, I'm feeling okay. It's not like it's not affecting me yet. What's that message to somebody who's maybe just stuck at that pattern of I know it, but I'm still doing good?
Well, asymptomatic diseases are challenging because the patient feels fine.
Right.
And sometimes I think the caregiver needs to just sit down with the patient and say, look, this is going to cause a problem.
Yeah.
We know if you get this, and then you got to share those targets with the patient. In other words, your A1C score for your diabetes needs to be below 7, or you've got cardiovascular disease. We need to get your LDL cholesterol down below 55, or you got high blood pressure, your systolic, and teach them what the targets are, and then work with them as a partner to help them bring it under control, which is lifestyle. And nowadays, a lot of this is driven by pharmacological therapy. Most of the studies have shown that whether it's heart failure, hypertension, diabetes, that usually by the end of the study, the patients who are using pharmacological management to get to their targets are the ones who have fewer complications, better health, less death. I mean, this is serious stuff.
It is.
But again, if you don't rotate your tires, you're going to have a blowout. If you don't change the oil in your car, and your body's, unfortunately, you can't replace it. And these parts aren't, I know we do transplants, but that's a failure,
Right.
You have to.
Well, and it's one of those things where if you can manage it now and take care of it, let's do it whenever it's not a mountain yet and it's still scalable. And, that's why I really enjoy these conversations, because they are that connective. To me, it's very simple. It's no different than a car, like you said before. And one final question. Do you see a lot of individuals that have multiples of a condition, as if it's diabetes and high? Is that common for a lot of your patients that
Oh, absolutely.
Interesting.
Yeah. And that's part of the juggling is, somebody comes in with 4 things and they're on 6 drugs, and you're trying to, and you're looking at 30 data points in the labs, and insurance wants you to do it in 15 minutes. It's kind of, but I think that one thing that's helping is when the patient knows what the targets are, they're much more likely to be engaged.
Yeah.
And it makes it easier to do these things.
Well,
And I think these wearables and the monitoring, and particularly the in-home monitoring for our complicated patients that we talked about, like I said, we've got about 100 patients right now, but we think, we did an assessment, we think we probably will be up close to 400 patients by the end of this year who will be using that kind of technology.
Wow. And it's great to know that, you're seeing that, at home, and at least to monitor that and, keep everything in line. And Dr. Green, for patients who, want even more hands-on, I think this ties back in really to the enhanced wellness care program, so well, because, like you just mentioned, you only have 15 minutes, with, insurance and, things happen with the enhanced wellness care program. It seems like individuals, you really have that time to really go in depth with this, even more so than what you just described now.
I do, and that's the big piece of the enhanced wellness program, really, is the time of the visit. So the regular visit in that program is 30 minutes, and an annual wellness is an hour plus a follow-up visit. And that allows me to get into the, what's important to you. We actually have a checklist, what's important to you today. And then we focus on what I think is important, of course, as the professional, but we also drill down into their personal concerns. But sometimes if I'm writing a new prescription, sometimes then I have the time to explain why this drug is going to work, how it works, what the studies showed about it, what the side effects might be. And I'm just totally sold on the fact that extra time ensures that the patient knows why we're doing it, and their compliance. They're going to go get it, they're going to fill it, they're going to take it.
Yep.
And it's a lot different than a 30-second, here, take this, and then move on to the next thing. And, well, what's this for? What's it going to do? I think that the time with the patient allows them to become better partners in their own care.
1,000%. And that leads me in, is there still opportunities to join up with this program?
We still have openings in the program. They just need to call the office, and the staff is well aware of what they're supposed to do.
Dr. Green, it's always great talking with you and gain valuable insights each and every time. I hope you have a great rest of your weekend, and we'll talk again soon.
Good talking to you.
We'll link everything in a write-up on RiverBender.com. The time's 9:44, a little bit of change. We'll come back and wrap up the 9 right after this.